Hey guys, welcome to my channel, Family for the Pcos. This is my first video today, and this channel, I'm creating it for all of my family, friends, people who don't even know me, who may be struggling with PCOS, infertility, or if you're going through an IVF cycle and you just want to know what the steps are like. I will be posting the good, the bad, the ugly of all of this, no matter how it turns out. Of course, my husband and I are praying for a baby, a blessing, and we know it's going to be coming, and we're praying for that. So thank you for tuning in. Thank you for all of the support that we've received from all of our friends, our family, and all those who have provided us with words of encouragement, because you know part of what we're going through. So thank you so much for tuning in. So basically I have PCOS. It's called polycystic ovarian syndrome. It's a condition that some women have, which affects their fertility, their weight. You can get like excess hair growth in certain places that hair doesn't belong. And yeah, but it affects people in different ways. But this is just how PCOS affects me. It affects my fertility. And I have absent menstrual cycles. I have gone years without a cycle before, and have had to have the doctors to give me medicine to induce a cycle. Back when I was 17, my mom had me on birth control pills, and you know that wasn't something that I was too thrilled about, wasn't really into it, but I was active. I was a cheerleader, I was on the step team, I was doing things that kept me active. And you know, I probably could have had PCOS back then and just didn't notice it. So yeah, birth control wasn't for me, and it seemed like as soon as I was taken off of it, because for my own preference, it's just when it all went downhill. Like my cycles were just terrible. Like I would be lucky to have one every 6 months at that time, maybe 3. So this condition is like, you know, it's just been like a really bad curse for me. I'm not gonna go too far into detail about the past, but I will say it has affected a past relationship for me. And you know, it was hard to come up off of it for a while, to understand, you know, what this condition can really do. Like if you don't have a strong support system, you can easily crumble, easily. And I'm just so blessed to have my husband, who's older than me, but he, you know, and of course he wants a family, but it was something that I mentioned to him in the beginning, like we might struggle with this, you know, and he was okay with it. Like he's down for the fight, and that's what I need, somebody that's down for the fight, and he is. We are fighting this battle together. Yes, we are. So I'm gonna fast forward a little bit to my infertility journey. Back in 2017, Steve and I, we did our first go round with Shady Grove, because we were like, you know, I was probably like maybe 29 at the time, maybe 30. Was this 2020? Yeah, I was 29. So, you know, I was getting nervous, you know, I'm like, okay, excuse me, I'm getting sick. I do not have the coronavirus. I'm so certain I don't. Just a little cough, just a little cough. Yeah, so I was getting close to my 30s, so I'm like, okay, Steven, like we have to go and start getting checked out. Like I don't want time to be ticking and then we're too late with it. Like I just would like to know what is it we have to do, because when the time does come for us to have kids, I want to know what our chances are going to be like. So we went to Shady Grove. We tried a DC location, and you know, we had a okay doctor there. Steve didn't feel like they respected him as a man, as my man, as the man that was going to be the father of my baby. All of that. He just didn't get any respect from these people at this location. But we went through with it because, we already paid at this point. So they gave us all the testing. They checked my tubes. I got an HSG test done. My fallopian tubes were clear. Steve did a semen analysis. He likes to laugh at this because the doctor said, "Oh, you were flying off the charts. Your semen results were busting off the charts." I'm like, oh my God. So I already know it's me. That's fine. I already know. So anyway, he likes to make a joke about that. Like, it's you. It ain't me. So anyway, we got all of that testing done. And we had Kaiser at the time. But we were, just starting this whole thing. We had no clue how none of this stuff worked at that time. So they put us on a timed intercourse cycle where they still use the same injection medicine that we're going to be using for our IVF cycle to help grow grow our eggs. So we were on Gonal-F. It's an injection medication, and Menopur, and they also give you a trigger shot to trigger ovulation. So it's different shots for different things. But we were on shots for a long time, maybe about 2 weeks worth of shots before my ovaries started to respond, before my eggs started to grow. But once they started growing, it was hard to stop them babies. But anyway, so they gave us some medication, grew our eggs. They were only looking for maybe 1 to 2 eggs to grow because we were doing it on our own. They didn't want lots of eggs growing. And I think we had 3 at that time, and they were okay with that. So once they got big enough, they would call us every evening. I must have gotten stuck with needles every other day, but with blood work and ultrasound, getting this wand stuck up in my vagina every other day. It stuck in my arm. Had to find different veins because certain veins wasn't available because they had stuck them so much. So it was just a lot. It was a whole lot. So anyway, the doctor called us one day after we grew out 3 eggs, and she's like, "Okay, we need you to take the trigger shot to trigger ovulation for 1 of those eggs, or however many of the 3 was going to release, for them to release, and then we need you to have sex at this time, exactly when we said." We did it. I was like, okay. Then 2 weeks later, we get the call, "Hey, you're pregnant." It worked. It was the first try. But they stressed me out so much with, "Oh, well, your HCG levels, they're a little low." So then they start stressing you out in your brain. How are you supposed to be positive about hearing that you're pregnant? And then you got the doctors and the nurses like, "Oh, well, your numbers, they're not rising the way we look for." Like, this time, they're not going to stress me out. I can't do it. I'm trying to look at the positivity of all of this. So anyway, I feel like that played a role in what I'm getting ready to say. We miscarried that pregnancy, and it was at our 6-week ultrasound. We went in for the ultrasound to look for the heartbeat, and there was only a sac there and no fetal pole. I'm not sure what a fetal pole is, but it's needed, and we didn't have it. They couldn't even find where the pregnancy had implanted at. So they were ready to give us some medication or put us in for surgery or something because they thought that we were having an ectopic pregnancy. And I'm like, we're not having an ectopic pregnancy. I wasn't even in pain. So it was just different, different things. So, I'm sorry, my scarf. Let me fix this scarf. You know what? Let me just take that off. I look a mess. Okay, hold on. Okay, sorry. Anyway, back to regular scheduled programming. They were like, "Okay, you're having an ectopic pregnancy. We got to get you scheduled for all this stuff." And I'm like, I don't think we're having no ectopic pregnancy. No sooner than we left that appointment, maybe an hour or 2 later, I started bleeding. So we knew that it was going to be a miscarriage. So we were miscarrying. So we miscarried that at that time, that pregnancy back in 2017. The following year, we tried an IUI, and we couldn't get as far as actually doing it because I was over responding to the injections. And when you over respond, they have to cancel you because they don't want so many eggs growing at one time. So that cycle was out, thousands of dollars. I mean, we were just dropping money on these cycles like left and right, and we had nothing to show for it in the end. It's just so depressing, and you know, it's sad. Like, you know, I would go to those appointments, certain ones Steve couldn't make. He had to work. You know, his job isn't as flexible like mine, you know. And, you know, it would be times when it's just like, you see all these women in Shady Grove, all different races, different race of women, you know, different ages, all struggling. Like, it's just sad. Like, if you're able to get pregnant and have a baby, look at that as a blessing, because there's so many women out here struggling. And I would just give anything to have a baby right now. I really would. So if you are able to carry, if you are able to get pregnant, cherish that. Cherish your children. You know, it's a blessing from God. So yeah, back to 2018, we had to cancel our IUI cycle because we over responded. That was the same year Steve proposed, so we got engaged. Yeah, whoop 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 whoop. And then a year later, we got married. 2019, 4/20/2019. And it was literally the month after our wedding. So May, June, July, August, September, October, I had a cycle. Back in, I want to say it was September, we had a little pregnancy scare again. Actually, we got pregnant on our own this time, but again, it was something I guess we just didn't catch at the right time, and it just didn't stick. So I started bleeding again. After that, we were like, okay, let's wait till the new year, which is 2020. Maryland had this new mandate with IVF coverage, fertility coverage, and things like that with insurance. We thought that Kaiser would allow us to do it now since we were, you know, doing things the right way. So we got married, we had got on insurance and changed the insurance plan to be what it needed to be, all of that. So we decided to set up an appointment for Shady Grove. We chose Annapolis this time, and we are by far ecstatic about that decision. We're so happy with the doctor. We researched him prior to selecting this location, and Steve and I are both comfortable with him. He knows a lot about PCOS. He knows about the challenges, and we feel confident and comfortable that we are in the right hands. So at the first appointment, he goes over polycystic ovarian syndrome, breaks it down for Steve, enough for him to understand it, besides hearing it from me all the time when I say, oh, PCOS, he, you know, PCOS, that's all he hears. But he never really understood the dynamics of this condition, and our doctor explained that to him in a way for Steve to understand. So we are both in agreement with this doctor. He put us on birth control pills that day, and we also did an ultrasound that day where he checked out my ovaries, and he's like, whoa, you have so many eggs. Like, there's so many of them. Oh my gosh, it's just ridiculous. He's like, perfect foundation for IVF, and this is what we look for, these type of cases. People like you respond very well to this sort of treatment. So he's almost confident that he can get us a baby. So anyway, he put us on birth control pill for a whole month. So we started in January, and I just stopped last Sunday. When I tell you this birth control stuff is not for me, it is not for me. I don't like how it makes me feel. I don't like how I wake up. I don't like how my boobs feel. I feel like I'm carrying a mountain full of watermelons right on my chest. When I wake up, I have to hold my back. Like, this is crazy. Like, all of this, and this is not even pregnancy yet. Like, this is just a lot. So anyway, I'm so happy to be off of those. But I think they put you on those to kind of like, you know, keep you in line with the doctor's schedule maybe, and then maybe in line with the other IVF patients that he's working with, so you kind of be on the same schedule timeline kind of thing, I'm thinking. So anyway, yeah, that was what that was about, and we stopped that last Sunday. 5 days before last Sunday, we had our mock embryo transfer. That is what I was under the impression was going to be like a test run of the IVF. I was told that they measure how far back they put the embryo through the cervix and all of this stuff, right? So when I go in for the appointment, I'm like, okay, the nurse takes me in a room and I'm like, can you just explain to me exactly what this appointment is about to be? Because, you know, I was by myself. I really, you know, didn't know what I was getting myself into. And she's like, oh, they're just going to check for fibroids and polyps, and they're gonna put a camera in your vagina. And I was like, well, what the hell? Camera in my vagina? Okay, so then I started freaking out. She was like, don't worry, it's okay. Like, you're just used to cameras in your vagina, not me. So anyway, I was a trooper. I did it. The lady comes in. She's like, put your feet up on these stirrups. I'm wide open. Busted wide open, and then she's like in there with this camera, and I can see everything on the screen, and she's just like, we don't know what this is at the bottom of your uterus lining. We don't know if it's the lining because of the birth control, if it's just getting thick. But why would my lining be thick at just one little spot of the uterus? You know, this is not even the whole lining. So anyway, she takes the scan back to the doctor, and he examines it, and she comes back and she says, no, Dr. Motler comes back and he says, you're going to have a hysteroscopy. It's a surgery to remove. You have a little small polyp on the bottom of your uterus lining, and if a baby or embryo were to implant in your uterus, a lot of women miscarry because they don't know they have fibroids or polyps in the way of the foundation of where this baby's going to be growing. And it makes sense, but I was so distraught. I was just like, it was just as if like somebody had told me I had like a life-threatening disease. Like, I just cannot. I'm like, it could possibly be any more bumps in the road. Like, really? Like, I was just so hurt. And I'm going to post the on this video, I'm going to post the voice recording because I couldn't record it. I don't allow cameras in the ultrasound room, but I did record her, and you could probably hear, you know, me crying, you know, because I was just so distraught by it. So they take me in a room, and they're like, you know, we want to get this surgery done. You can only, you know, we need you to do it before you do the IVF cycle. So I'm like, okay, well, when can you do the surgery? She's just like, oh, well, you have Kaiser. We're not going to be able to do it because you have Kaiser. I'm like, what? Like, Kaiser has out-of-network benefits. What do you mean you can't do it because we have Kaiser? So found out Kaiser, you know, does cover it in a way. We have to pay a little bit out of pocket, but they cover some of it. So we were like, okay, sign us up. So they put us in surgery last Friday. I just had the hysteroscopy done. And let me tell you, that medicine, anesthesia, whatever they did, it was the best sleep by far. All I remember is being in the room. They asked me, oh, well, what do you want to name the baby when you have this baby? What kind of names were you thinking? I don't even remember getting the name out. All I remember is just waking up. And they showed me a picture of the polyp that they took out, and I'll post it right here. And it looks big in a picture, but they said it was small. So that is what they removed, and now we're working with a fresh foundation. So fast forward to today. we are starting our first injection tomorrow. We are so nervous. So I'm going to do another video, and it's going to have all the meds. I'll do a med breakdown of all different medications, the shots we're going to be taking, and when we're going to be taking them. I will do that, and I'm also going to probably do something with the shots so that you can see how I'm taking them and things like that. I want this to be a free for all for people who may be curious, or if you're just curious about me as a person, or Steve. Like, he's not gonna get on this video, so y'all can just almost can see him because he's not coming on here. So I mean, you just gotta get used to my face, and I'll just kind of, you know, give his thoughts to you guys through myself, but he ain't coming on here, that's for sure. So anyway, that's what we can look forward to, and I promise to share with you all the footage that I'm going to be making. You know, I'm gonna try to get as much as possible, but I want you all to go through this journey with us, a journey to a family for the Fizels, because we know it's coming. And keep us in your prayers and thoughts, please. And you know, if you have any positive words of encouragement, we will surely take it. We're going to be vlogging this whole entire journey so we can look back at it and, you know, one day share with our kids. You know, this is just, we're just so thankful that we have this opportunity. Like a lot of people don't, you know, and this is just the one thing that we're missing as a family, but we know it's coming. So thank you so much for tuning in to our channel, and we will see you on our next video. Have a good night. Thanks.
Take a look at your ovaries, then we'll go over the pictures together.
Okay.
There's your right ovary. Here. That looks fine. There's your right ovary.
Okay.
There's your left ovary. A lot of follicles.
Is that good?
Yeah, follicles are what house the eggs. Yeah. Okay, probe is coming out, but don't get up yet. Okay, that water's going to come out. You did great.
Okay.
All right.
Thank you. Okay.
If you can just hold your bottom up, sweetheart. Yep. And you're welcome to sit up.
Now?
Yes, baby.
Okay. Okay.
That's for you, sweetie. And there's some wipes in a little pad. Good
Okay.
luck, okay?
Thank you so much.
All right. So the dark is the water that I put in.
Okay.
And overall up top it looks fine. Nice and clear up here. Nothing worrisome. There is this thickening right down in here that's in the lower part. And it could be one of two things. It can just be your lining that's thickened there, or it can be a very small polyp that's developed. Not cancer, not worrisome. The analogy I use is like rocks in a garden, right? If I'm walking along and there's a rock there, no big deal.
Okay.
If that's where I want to plant my garden, it's a big deal. If I plant my garden here, but the rock is there, it's not hurting my garden.
Got it.
The challenge is when we get pregnant, whether it's on our own from having intercourse, whether it's an IUI with us putting sperm in, or IVF,
Okay.
we cannot control where an embryo implants. So if an embryo tries to implant on this area, it's not going to work. It's just like with planting a garden.
Mm-hmm.
When we plant a garden, we have control. If we couldn't pick and we just had to throw the seeds up in the air and pray that they land on fertile soil, you better believe I'm removing every rock so wherever they land, it can grow.
Okay.
So that's what we do with anything in the uterus. Is this something that causes infertility? No. Is it something that can decrease the success of treatment? Yes. So then the question is, do we remove it or do we not remove it? The recommendation, is Dr. Motley your physician?
Mm-hmm.
He's probably, there's two different things we can do. We can remove it, Or we can say, is it just your lining that's thick? See how this bright white outlining is your lining. It's
Okay.
thin except for right here. See how bright white it is there? It could just be your lining that's thickened there. So he could say, okay, let's just have you have a good period and repeat this to see if you can shed this on your own.
Okay.
Or he can say, let's remove it. Or he can say, no, it's lower. Most pregnancies occur up higher. Again, if this is our fertile soil and there's something there, the majority of my garden is fine.
Okay.
So let me get his thoughts while you're getting dressed
Okay.
and see what he says. So it's that area right here that we're paying attention to, pretty low in the uterus. So I'm just printing these pictures so that while you're getting dressed, I can show Dr. Matla. So we'll do this. I'm going to step out, let you get dressed. She gave you a pad. Just take this paper to the checkout counter and I'll meet you on the bench. And Dr. Matla again will say, nope, it's small, it's not in the area, fine. He'll say, we need you to have a period. Or he'll say, we need to remove it. And if he says we need to remove it, then I'll talk about how we do that.
Okay.
All right?
Okay.
I know it's a lot of information. None of it's a roadblock. It's nothing. It's not cancer. It's just if you're going through treatment, we want to give you every chance for success. Could you get pregnant with this? Absolutely. Women get pregnant with polyps or fibroids or things in their uterus all the time, but we want to give you every chance for success. So
Got it.
okay.
Okay.
All right. I'll meet you out here.
Okay. Thank you.
You're welcome.